Hi, this is Linda. I'm going to be talking about the role of health coaching in an integrative healthcare system. So an overview then of this presentation is to look at what is integrative healthcare and what is integrative healthcare coaching, what do those coaches do, where are they, and to look at trends and shifts in priorities that really let us know that we're moving toward this integrative system, and then to look at our takeaways. All right, so we have a very, 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 very broken healthcare system. It's beyond our wildest dreams of what we want, what could have been created, and certainly what we want. So an integrative healthcare approach is really in response to that very broken system. And so this integrative healthcare approach really addresses the whole system. It can be the whole person, it can be the whole family, the whole group, the whole community, and then how that's really embedded in a bigger environment as well. So it goes beyond looking at a symptom to also address what is the root cause. One of my favorite powerful questions is what's really going on here. It blends multiple healing modalities, so it's really about coming into this situation with various ways of perspectives, ways of addressing healthcare issues. For example, someone might have a high blood pressure, and when they reduce their salt intake, blood pressure goes down a little bit. When they address their stress in their life in general, goes down a little bit. When they learn how to communicate what their needs are, what they really want from various people and things in their life, it might go down a bit more. And let's say then they add exercise. Well, suddenly it goes down a lot because these multiple interventions potentiate each other. And that's where we find these big changes happening. And the goal of this kind of integrative healthcare is really to be seamless. And for that to happen requires a fair amount of collaboration between the different modalities, and also a basic way of addressing and looking at situations from a systems perspective. So here's a definition of integrative healthcare: partnership between patient and practitioner, or group and practitioner. But the partnership is a word that really needs to be underlined, and certainly different than it has been in the conventional setting. So it's an interdisciplinary, non-hierarchical blend of both conventional medicine and complementary and alternative healthcare. Again, looking at that multi-perspective approach and working with a team and resulting in a more effective and cost-effective care. I was just talking with someone who's in a medical home, and he is the coach in the medical home, and he really loves his job because he has the ability to work with people more specifically on goals that they're taking on, and they're just in the process of gathering the data, but they know that it really is more effective and the cost is going to be lower than a conventional system. So add health coaching. It is the missing link in our current healthcare system, and it defines success not as procedures or tests, but as a better patient engagement and outcomes. Patient engagement is the buzzword these days. The conventional system knows that handing someone something, telling them what to do, doesn't really work. So everyone's wondering how to get the patient engaged, and that is what coaching is so good at. It comes from this way of not telling people what to do, of really helping them find their intrinsic motivation, and that's what makes lasting behavior change. It bridges that gap between recommendations and the patient's or client's ability to implement those. It's really about getting information and then the coach asking the client, of these changes that your doctor wants you to make, which ones are you really ready for? Where's that readiness to change? So health coaches, integrative health coaches, assist patients and clients with their changing. It's all about changing those lifestyle patterns. It's those minute by minute choices we all make every day, whether it's to do that yoga stretch or to stay at that computer, or if it's to eat that fast food or to pack something from home so that you have something to eat. It's those minute by minute changes that we're all involved every day that makes a real impact toward our health. It's about making referrals to healthcare, interdisciplinary healthcare teams, and it's working preventively to help people make those really optimal life choices. And it's doing that with people at all levels of health and wellness. So whether it's someone who's in a dying process or someone who's 20 years old or 25 and really wants to get a little better in terms of their exercise program. It's addressing those choices. It's helping people stay in choice at all those various stages of life, really. Some of the popular complementary and alternative approaches, according to a 2007 study, is the first most popular is natural products, deep breathing. We really have that listed, and it's amazing that that's really one of the second most popular approaches. Something you have with you all the time. It's free, and it really takes that couple seconds. We know as health coaches that it connects body and mind, and that's why people then have more ideas. Something pops up when they haven't felt able to move forward or been stuck. Meditation is the third, probably moving up, I think. Chiropractic and osteopathic interventions are really important. Massage, yoga, diet-based therapies. Everyone's quite getting, I should say, getting a little more aware. I think that really in the last maybe couple years, there's been a big shift in approaches to food. Even fast food now have to list the calories. And so, of course, they're coming up with, instead of the big Whoppers, they're small Whoppers now. But people at least are looking to change some of their behaviors, and we're getting more and more information about what we do choose and what the repercussions of that is. Progressive relaxation, guided imagery, and homeopathic treatments are still very popular in this day and age as well. So where are the health coaches? My goodness, they're everywhere, and they're going to be even more in more places and more of them. Hospitals, medical homes, as we talked about, home care agencies, insurance companies. There are a lot of other healthcare providers that are going after the market of self-insured companies, because those companies are really very interested in lowering not only days that people are absent, but also looking at presentism. So how to help people be at their desk, but really awake and alive, I guess, really able to be effective and produce the work that they need done. Spas, I used to work at a spa. I used to do 15-minute wellness consultations, and it was great. I really wanted to set up a continuing program, but then the spa was sold, so I didn't get to follow through on that. I think it's great for people to get away and do something where they have yoga or good food, and the crunch comes, the rubber meets the road, so to speak, when they get home on Monday, and how do they have any way to integrate some of those changes. Churches, I've started wellness committees, wellness programs in churches, hospice, YWCA, of course, private practice, doctor's offices. I worked with a physician in New York at one point, and he really filled my whole practice, so it was a wonderful experience. And dental offices, I really want to add dental offices because I've been working with the dental office in DC, and I'm training their staff as coaches. I think it's a wonderful place to have um, an expanded role for the hygienist, for one thing, because people are there, they're kind of tuned into prevention, and they're also not expecting their health insurance to cover those things. So there's new programs going into dental offices. There's some, I know of one group that's doing some kind of heart test, and then they have a coach following up with that person if certain results of that test are positive in a way that they need an intervention. Another recent indication, I would say, of things shifting, I just listened to the Robert Woods Johnson Foundation, their priorities for funding, and I was delighted to see the shift because what they're funding then, of course, gets bigger and has more impact. They're looking at early childhood education, community revitalization, and broader health care scope. They're convinced. They had many, many people talk with them about early childhood education, and they're just, they said the research is astounding and solid, that what needs to happen is there needs to be this education for all young children, and especially low-income children, and that when that's done, it makes a tremendous difference in terms of the childhood development and health and wellness. The other thing they looked at was this same kind of silo effect in our communities where there's different um, health agencies that are maybe in the nonprofit sector, but they're all also in silos, and that a lot of wheels are being reinvented. So really wanting to create communities that are collaborative so that they can reach especially low-income neighborhoods and provide services that are integrated. Okay, the third and definitely not the last most important part was looking at broadening the healthcare scope. They looked at care systems and said that they really need to add a much broader way of helping people. There needed to be lawyers on the team. There needed to be people that knew how to get food stamps on the team. There needed to be people that would let them know where's the nearest park to where they live. I was really delighted the other day. I was walking in my park, and there was a group of school children working with the wellness, I'm sorry, the wilderness expert, and he was talking about where their school was. There was a great park and close to them, and that it was where ladybugs were there at that very moment in a very large migration. So I think this idea of helping kids and people get outside. There used to be this one program called No Child Left Inside. So there was a great program about how to get kids outside. So this idea of communities also coming together so that there's not just silos, so that there's not nonprofit silos just as there are in healthcare, so that the wheel does not have to be reinvented all the time. So there was a big push that they were going to be funding projects where communities would really collaborate. Community health organizations would really collaborate, especially in areas where people, low-income areas, so that people could not only have more needs met, that it could be done in an easier and more seamless way. So, as a takeaway then, coaches have a key role, yay, in an integrative healthcare system. There's a large cultural shift toward prevention, education, and empowerment, patient engagement, and coaches are an integral part of that healthcare team.